What's going on YouTube? It is Adrian Hawkins of HawkFit, and we are bringing you another episode in the series, Rehabbing an Injured Athlete. Today we've got the doctor with us, so with that being said, let's go grab him and get right into it.
Okay, so here we are. Today we're going to address, last time we talked about the foot injuries. Today we're going to go up higher, proximal, and that is the knee. The knee is the joint. That's what everybody calls it. But it's a joint. It's a joint that is supported by several things. Of course, there's the muscles that come from the top part of the knee, and there's muscles that come from the bottom part of the knee. A knee injury becomes an injury by either tearing something, the ligaments or the tendons, or straining the muscles that lead to it, and then you get either a lateral shift of the patella or a medial shift of the patella. And then you can also get knee injuries or knee pain when you degenerate the knee. That's in the advanced age. Or you can get something that they call Oshgood Sclatter. That is something that teenagers usually get. Teenagers who like to do a lot of heavy lifting and squats, and so the pain develops over time over inflammation, so you get some kind of inflammation on the distal part of the patella or the inferior part of the patella for younger people, teenagers especially, 12 to 15 years of age or a little bit older. But those are the four things that usually affect the knee. Either you can snap something in the knee, the tendons, MCL, medial cruciate ligament, or lateral cruciate ligament, or ACL, anterior cruciate ligament, or posterior cruciate ligament. These can happen when you land or you squat or you jump and then you twist while you're landing or squatting, and then you can have a strain. So this is the second one, which is where the patella is pulled to the medial side using the inner quad muscles, or it's pulled to the outside using the lateral side of the muscles. Or you can have degeneration of the knee. Of course, it surfaces that the top part of your leg, which is the femur, and the bottom part of your leg, which is the tibia, grind together. So you can have that degeneration. Or the fourth one, you can have little scores or a little bit of a cut, which is your meniscus because of a very tight squeeze. So here's a diagram we have here. These are the muscles that build up the knee. Like I said, the knee is a joint. Yeah? This is the lateral side of the knee, a lateral view of it. We will go into another picture which shows us more when you're looking from the front, but this is kind of a side, a lateral. And here we have the hamstrings, which connects the fibula. Then we have this little ligament here, you can see that. That composes some of those lateral cruciate ligament. And then we have the vastus lateralis, the vastus medialis. This is the rectus femoris. This is hamstring. Another name is biceps femoris for it. Then of course there's another one down here. That's called the gastroc. And then there's another part of that which is called the soleus. These are the bone matters that join to create the knee. You can see it's just floating, but these are the ligaments that kind of hold it together. Do you see that patella? That's the bone. Patella, that's the first piece. The second piece and the third piece. Three things make that. You're not here for a lesson, you're here to learn the injury. So injuries can happen if this muscle is so tight, it will pull that outward. It will pull this outward. If that muscle is so tight, it will pull that patella inward. You see what happens? If you land, you could tear that. That's on one side. Let's look at the anterior view. These are your anterior view. So you can see these are your lateral, your medial cruciates, your posterior. This is what allows you so you don't overextend your knee, the posterior ones. The anterior cruciate. So a lot of people, when they hyperextend or hyperflex the knee, they tear that. And then these are the lateral, like I said, and the medial. This is the side. Now look at the muscle, how the muscle comes and attaches to that. Now here, what happens is, this is the sartorius. You can see it coming hooks on there. And then this is the IT band, comes and hooks onto that too from there. And then this is the rectus femoris right there that comes with it. So all of these, depending on the tension, they either pull and press that on there. So anything under there is called a bursa. Some of these, there's some bursa under there, some water sacs. So now I have broken it down, I've gone down further. I am here. You see, that's the rectus femoris. There's a tendon that protects the patella. That's the femur, that's the tibia. These are little water sacs that sit under the tendons. The one on the top, suprapatellar, you can see that because it's right on top of the patella. Pre-patella bursa is the one that just comes before you hit that. So if you land on your knee crazy, you can really irritate that. And then you have the one on the front here, number 3, deep infrapatellar. That's right at the bottom, infra. And then another subcutaneous right under the tendon of that. So you've heard of pensacoline. These are 3 muscles that create that gracilis, sartorius, and the IT band. They come and connect there. But anyway, so when you irritate these, you get something called bursitis. That's another injury. I'm sorry, the 4th one that you can have for injuries of that. All right? So now that I've introduced you to the structure of it, there's one last piece, the meniscus that we talked about. Meniscus. I told you that meniscus is an injury that happens. Let's see. So this is the top part, that's the bottom part. And the meniscus is a little crescent-shaped thing. It's a little moon-like thing, like that sits right on the bottom of on the top of the tibia, so that the femur can grind on it, so that you don't hear the crepitus, they call it. If you land on that and you twist a certain way, it will tear a little bit of that, or a score like that. And they can go in and repair that like that. But if there's a little bit of a piece that you tear, you score up, and so it'll just be lingering. So every time you fold your knee, it'll be, ouch, that hurts. So that's the meniscus. So that's another injury that you can have. Let's talk about how these muscles can be helped so that you don't have those injuries. First thing is always stretch or a good warm-up. If you don't warm up, I'm sorry, that's the rule number 1 that you're letting down, because you make your muscles vulnerable. Okay? All right, we can stop from there. That's number 1. Number 2, always when you're done working out, especially in the knee area and they're feeling discomfort, since there's something called bursitis, which is inflammation of those sacs that I showed you earlier, that's inflammation. You want to cool your knees off by putting ice on it, so those bursas are not screaming at you that you irritated me too much, I need you to do what? Calm me down. The rest are physical, mechanical works that you can do. And we're going to use Mr. You-know-who to help us out on that. So let's go to our next step. So this is the medial. That's the medial. And that comes and joins the top part like you saw in the diagram. So that medial goes and joins to hold this up. And as it holds it up, it locks it into place and it sits on the meniscus. The meniscus sits on top of this one here, the tibia. So that's that. Now, if this is pretty strong, some of this muscle through the tendon is attached to the patella. So if this muscle is too strong, it will laterally shift. It will laterally shift, medially shift the patella, medially. Vice versa. if this lateral vastus lateralis is strong, it will shift the patella laterally. It will go that way. So a good way to check the strength on that also is you press it, and if there's crepitus or there's a grinding sound, there's looseness in here, there's a little bit of, we don't want that. We want these to be nice and strong. So the therapy for that, a lot of times someone will say, hey doc, I feel pain in my knee. I said, what side do you feel your pain on? Well, most of the side, I feel like there's pain here. Why? Because this is trying to shift that way, and so it's pulling on the inside. Or they'll say it's on the outside of my knee, so there's a bursa under there, so the inflammation is there. Or this one is so strong, it's pulling the patella on the inside. So those are the two different things that can happen with that. How do you strengthen that? Or how do you fix that? So number one, if there's a lateral shift or a medial shift, you strengthen the opposite muscle. So if there's a lateral shift, you strengthen the medial. If there's a medial shift, it means this is so strong, you strengthen the lateral. And then another thing, if there's a medial shift, you roll on that one. You roll on the medial, the vastus medialis. That's what you roll on. And if there's a high shift and there's always a tendon pulling on there, if it's a teenager, it means they're growing so fast, so the bursa under there is getting upset, and so you see a swelling there, and that's called the Oshgood Sclatter. So you need to roll on that to loosen that up, stretch it, so it's not tagging on that, because these muscle will pull there, and they will create inflammation on there. Does it make sense what I'm saying?
Absolutely.
Yeah.
So if your inside is hurting, then that means you need to work on the outside.
Yeah.
If your outside is hurting, that means you need to work on the inside. If it's hurting down here, or you're going through a growth spurt, then you need to roll up here.
Yeah, you need to roll that. And so I'll do that. I always take pleasure in hurting Adrian on your behalf, on everybody else's behalf. All those of you who've always wanted to put a little hurt on Adrian, I do that by doing what? So I will put it on here, move this a little, and for the top part, I roll on that. That's for the Oshgood Sclatter. Of course, you ice it, and you ice here, ice this, ice that. When you ice it, it loosens that up, lengthens it a little bit, stretch it, and then it doesn't do a constant tug on that. I know you've seen people wear stuff around like that, like a brace. Mm-hmm. So usually what they're wearing that for, especially football players, because they keep, this gets so tight and it pulls on there. So that kind of is like a dam. Mm-hmm. It blocks so that it's holding the big flow of strength being tugged on that. So it's kind of helping it so that it relieves the tug of the proximal tibia, anterior tibialis. So rolling is a good measure. Side rolls is a good measure. Side rolls is a good measure. Now, a lot of injuries happen because there's a lateral shift. Why? Because there's a IT band also, apart from the lateral, that's pulling onto that. So someone's foot, if you see there's a little bit of a shift, if they're laying on their back and you tell them raise your legs up and you see the foot turning to the left, it means that the IT band on that side is really tagging on that knee and rolling. So they are walking, and as they walk, they're putting pressure on this knee, because this knee naturally is supposed to be here, but constant twist, when you can see the confusion, and so there's pain on the medial side. Cool?
Right, absolutely.
Okay, now the other one is the PCL, which is the back side of the knee. So when he's doing that and he feels a little zinger, that's the PCL that you're challenging. If you're climbing up the steps, or you wake up in the morning and you start walking and you feel pain in the back of your knee a little bit, it means your hamstrings are very tight. Your hamstrings, there's 3 of them. 2 of them come to the lateral and 1 comes to the medial. You can guess which one will pull on most. A lot of times people's hamstring, a lot of times they feel pain on the left, on the outer side, because that's where the 2 hamstrings are, the biceps femoris and the semitendinosus on the lateral side. Then the membranosus is on the medial side. So a lot of times, lay on your tummy, bud. A lot of times, rolling on that relieves it a little bit. Okay? And there's another muscle that runs across us called the popliteus or the plantaris. Roll on that. That also helps it. Yeah? Roll all the way up. Have someone do that for you, because that breaks some of the tension that is in the belly of the muscle. All right? So apart from that, stretching it, laying on your back. Lay on your back, brother. After doing that, and then bringing that up, straight up. So that really works on that part. And you can see the belly of his muscle. You can see, so I'll let you can see where the insertions are on there. That's the biceps femoris. You can see the depression right there, and that's where they insert. So he's really developing that, but you stretching that will really help, because that goes all the way back to these. You see these little tendons here? These come from the biceps femoris, and that comes from the other part of the hamstring. It's like a guitar. I could actually play a song. That's how his are so strong. All right, that's it.
All right.
Okay, so to go outside to help with that, he's gonna go show you some deadlifts to help with that.
All right.
And some side squats. If your medial is not strong enough, then you do side squats. Yeah? Yep. If your inner is too strong, then you do the side squat. If your outer is too strong, then you got to do exercises like the sumo squats to help with that. And it doesn't have to be heavy. Why? Because you're trying to balance. You're trying to bring balance to your knee. That's what you're trying to do. I mean, just imagine whatever is strong is what's going to pull it, either medial or lateral. So your work is to do sumo, lateral squats, or deadlifts. Take your pick. And of course there's calf raises, because the calf muscles also come and transition into your upper distal femur. There we have it. All right?